Good afternoon, everybody. Thank you so much for joining us. And can I just say before we start, I would challenge anyone to find a vaccination or testing site with a better view in all of America. We're here to talk about the city's expanded efforts on vaccination, which would not have been possible and will not be possible in the future without the help of our partners. This pandemic is a once-in-a-generation challenge. It's not something that any individual, any city, any organization can do on its own. It takes all of us, from employers to healthcare providers to philanthropy to our community-based organizations and to all levels of government, using every tool we have, working together. Close collaboration is the only way that we can return to a safe and healthy community. We know that Seattle's road to reopening has to travel through the path of vaccinations. We will not be able to see our downtown recover, our economy recover, or our communities become vibrant again until we vaccinate 70% of Seattle adults. We also know that COVID-19 pandemic has had an outsized impact on our communities of color, our immigrants and refugees, and our older Seattleites. In King County, for example, Black communities make up 12% of the COVID-19 cases. 12%, despite the fact they're only 6% of the population. Our Latinx communities make up 24% of cases, despite the fact they're only 10% of the population. And yet we see great inequities in delivering the vaccine to those people who are most vulnerable to this disease and who need it the most. We have to be intentional in our efforts, and we cannot sacrifice equity for speed. Those who have been disproportionately impacted and most vulnerable to this disease must get vaccinated. Even with our limited doses, our Seattle Fire Department and their efforts have shown that we can vaccinate people quickly, efficiently, and equitably. Over the weekend, our Seattle Fire Department administered its 10,000th vaccination. Roughly 70% of those people that we have vaccinated through that program identify as BIPOC. While these are limited efforts to begin with, because we have limited doses, I'm very confident in our ability to scale up. Ultimately, we must expand our vaccination efforts. I want Seattle, and of course King County, to be the first area to have all of its 70% of its adults be vaccinated so we can reach population immunity. Now that we are anticipating the city receiving more doses, we are ready to significantly expand our vaccination efforts. Starting today, this site at Rainier Beach and our West Seattle site where we were last week are being converted into fixed testing and vaccination clinics. That means that each of these will be able to operate weekly with the doses we get. That's between 1,000 to 2,000 people per week. Once supply ramps up, we estimate that we can do as many as 1,000 people per day at each of these sites. Right now, registration for both Rainier Beach and West Seattle will be made through referrals from our community-based organizations and faith-based partners. We've been participating with over 50 community-based organizations and faith-based organizations serving primarily BIPOC communities, older adults, immigrants and refugees, to get people registered for the clinics, to reach into those communities who have not had connectivity to the vaccination process, to make sure we get them vaccinated. Our approach has been successful. 85% of those people who registered for this clinic identified as BIPOC. These two clinics really will become neighborhood hubs in some of the hardest hit communities, and in West Seattle, a community that has been significantly cut off and isolated since the West Seattle Bridge has been out. We have to have a multifaceted approach. We need to be able to do high volume sites as well. That's why we are going to be partnering with Swedish and First and Goal to operate a mass vaccination site at Lewin Center. This site will open later in March. Initially, it will vaccinate about 5,000 people per week. At full capacity, we may be able to get as many as 20,000 or more vaccinations a day. It will depend on supplies and scaling up. But we've been working on building this ability for months. Appointments at Lumen Field will be two kinds. We'll have some appointments that will be prioritized for community groups that are most vulnerable, but the rest of the public also will be able to register for vaccination times there. It is going to be critical to us reaching that mass vaccination number. I really want to thank our partners at Swedish and First and Goal for their collaboration to set up Lumen. Dr. Hudson, it's been a lot of late nights since a year ago when we learned that COVID was in our community. I also want to thank Patty Hayes, who's not here today because she had other obligations, but her work through public health has just been phenomenal over the last year. I really want to thank our incredible community-based partners. And I have to give a special shout out here to LYNDA GREENE, who's from the Southeast Seattle Senior Center. It seems like 20 lifetimes ago that we were there enjoying and touring and meeting with people, and just on a dime, everybody had a pivot on how they provided services and what they did. I really want to commend our fire chief, Harold SCOGGINS, who's on his way here but got delayed. And of course, I have to thank my partner, CONSTANTINE. Throughout this process and throughout this challenge, both the health challenge, the economic challenge, and the civil rights reckoning, Dow has been just a steadfast partner. It is all about solutions and getting things done, and we could not have done any of it without. So I want to say to anybody watching this, please continue to do your part. If you're eligible for a vaccine, get registered, get your vaccine. We need you to do it. Continue wearing your mask, keep your social distance. Hope is on the horizon, but we're not done yet. And with that, I'll turn it over to to Dow Constantine, who will talk to you from the county's perspective. Executive.
Well, thank you, Mayor, and thanks to everyone, including the geese and ducks behind us, for being here and participating so enthusiastically.
It cracks me up.
I know. No. That's not allowed. And thank you, Mayor Durkan. I'm really pleased at the progress that's being made here. We are getting there. We will get there, but we need to get there together. It was, I will remind you, depending on how you count, 1 year ago, right now, that we were beginning to gather at the Chinook building in downtown Seattle, where we stood together and announced that the COVID, what was then called the novel coronavirus, had landed here in King County. I had flown in from Washington, D.C., came directly downtown to the building. It was on the 29th of February. And here we are a year later. Many of our folks have been working 7 days a week since then on this remarkable challenge. And that's when, leaders from across the region and from throughout our community really began to join together to galvanize, take on this challenge. We think back about the pain, the sacrifice people have made, the loss that has followed since that day. It's really been unlike anything we've faced as a community, at least in a century. And now we're here to mark the opening of these new vaccination sites. It's an exciting moment, and it's exciting to include not only this picturesque spot here at Rainier Beach, but also one of the biggest sites in the region at Lumen Field in downtown Seattle. It's testament to the work of the researchers and scientists and our community's outpouring of support for one another, the caring for neighbors and those we've never met. Our vaccination sites around the region operate really at the intersection of government and healthcare and community. And King County is working to ensure, along with the city of Seattle, that every adult resident can get vaccinated. And we're working with community partners to make that happen, both quickly and equitably, as quickly and as fairly as possible. I really appreciate that Seattle and Swedish are following that model to ensure that we get the vaccines out quickly and to make sure that everyone who is eligible has fair access to them, equitable access. Ensuring that this site and these other sites will help individuals who are most at risk, and will help individuals who've been most excluded from access to medical care and to vaccines. Rainier Beach, West Seattle, Lumen Field will complement the sites already operating in South and East King County and serving thousands of people each week. As you'll recall, King County opened sites in Auburn and Kent, and those are really focused on reaching communities that have been most impacted by the virus and had had the least access to the vaccine. And we also teamed with our network of community partners to make sure we're reaching communities that may have distrust of the traditional systems or may not be as well connected and able to get appointments. And that's been really successful. And as we opened in Redmond, with the help of Microsoft, we continue to focus on reaching BIPOC communities throughout the east side and reaching out to get people appointments, the people who are eligible, to make sure that this vaccine is getting to the people who need it most. I'm really pleased to be able to share some numbers with you today. As of today, we will have provided 500,000 doses of vaccine countywide. And what's more than that, that means 2/3 of those currently eligible will have received a vaccine. And some 70% of licensed healthcare workers will have received a vaccine. And 60% of those over the age of 75 will have received a vaccine. Now think back even a month ago at how difficult this seemed, how halting the rollout seemed. I'm stunned that we are already reaching those numbers, and I'm excited now for us to be able to get the rest of those eligible folks vaccinated so that the eligibility can be broadened and more people will have access to the vaccine. Remember, a year ago, we were the epicenter of the virus in the United States, and as we mark what is a truly solemn anniversary, I want to leave you with this statistic. Of the nearly 100 most populated counties in the country, King County has achieved the second lowest rate of COVID cases of any of those counties, bested only by Oahu County. And the mayor and I are going to be doing an in-person investigation of what they've been doing right in that county shortly, I hope. Yeah. The achievement is only possible because community pulled together. And I told this to a reporter from back east who called me, like, what was different? Well, the elected officials, who I think Your Honor you will agree don't always agree on everything, were able to nonetheless stow their egos and try to speak with one voice to the public rather than creating some of the confusion we've seen in other jurisdictions. I'd point out New York as an example. But also, the people listened. They listened to the scientists, they listened to the public health experts, they listened to the doctors, and they knew that they needed to step up and put selfishness aside and concentrate on what they could do to protect their neighbors from infection. And because people did that, because they adopted these public health practices early, because they agreed to make sacrifices, we were able to keep the rate of infection down here. There have been many tragedies. We've lost more than 1,300 people in this county. But we have also saved thousands of lives. And when I say we, I mean all of us, all 2.3 million of us together doing the right thing, have saved thousands of lives. So thank you. That achievement is a strong foundation, but now it's time for us to gird ourselves for the final stretch of this race, to keep doing the things that have saved lives, even as we work to get the vaccines out equitably and quickly. Let's keep going. Let's make sure that we all get through this together. Now I'd like to introduce one of the community partners who is helping to ensure that fast and equitable distribution of vaccine, the Executive Director of the Southeast Seattle Senior Center, LYNDA GREENE.
Hello everyone, it is truly my pleasure to be here today to talk with you about some of the work that we're doing at the Southeast Seattle Senior Center. When the pandemic started a year ago, we needed to redirect all of our services, meaning all of our program was changed. We did not have any of the seniors coming into our center at that time. So we began to focus on the seniors who were homebound, meaning they were unable to get out, they were unable to come to the center to enjoy a lunch with their family members and with their friends. So our goal was to make sure that all of the seniors who needed our assistance could in fact get lunches. And so in redirecting our services, we started out by preparing 25 meals per day. We hired a chef and he cooked the food for us. We are now at 170 meals per day, 5 days a week, with a small staff at the center with incredible volunteers, and we are so excited to have them with us. One of the things that we also learned is that as we were moving forward in this process, depression became a major issue for the seniors. The seniors that we serve are primarily over the age of 75. The majority of them live alone. The majority of their adult children, they don't live in the state in which the parent lives, and so there's isolation. And so one of our goals was to reduce the isolation as much as possible. So we put together a team of volunteers, and they worked with a list of over 1,000 seniors in our community, and they actually made phone calls. They talked to each and every one of the seniors, and our seniors shared with them what their concerns were. It was very beneficial to us because we were able to identify those folks who were suffering from depression. We could connect them with our social worker, and we could begin to help them move through this dark period of their lives. So I am forever grateful to the staff and the numerous volunteers that we have at our center for making the lives of our seniors better, and I appreciate them tremendously. One of the ways that we've partnered with the City of Seattle through many programs, and I have to say we've been working with the City of Seattle for a number of years, and this is probably one of the most effective programs that we've partnered with in all of the years that I have been here, and I'm approaching 11 years with Southeast Seattle Senior Center. I also want to compliment the staff. The staff that we have been working with at the City of Seattle has been tremendous. They've offered incredible support, and we are grateful that we have them to work with. The selection of this site is incredible. This center represents the BIPOC community. The majority of the members of our center are members of the BIPOC community. The calls that we have received from folks who want to get vaccinated have been incredible, and I will tell you, unless you're on the other line of that phone and you're hearing the stories that they're sharing, they've called 5, 6, 7 other places and they cannot seem to get a vaccination. They don't have access to computers. They're not computer literate for sure, and so the fact that they are calling us because we've reached out to them, it's been incredibly helpful for us and for them. And I have to share with you that I almost didn't come today because we have a list of over 200 names of seniors who still want to get vaccinated. So I came because of you. And I'm here because this announcement is really, really important. So I do have a staff at the center now, and they're working on getting those calls made and getting those appointments made for our seniors. Finally, I just would like to say that this site is so important because the 98118 zip code, as you know, it used to be the most diverse zip code in the nation. And I think now it is still number 2. So the folks that we need to reach, the folks that we need to target are in our area. We know that seniors have issues with transportation, and I'm very, very hopeful that that will be an area that we will be addressing in the very, very near future. Many of them don't drive. Yesterday we did work yesterday to make appointments, by the way, and I received a call from a gentleman who was in Federal Way, and his car broke down, and he wanted to know, how can I get there? He was only in Federal Way because one of his children lived in Federal Way. He lives in 98118. So transportation is a huge, huge issue for seniors, and I hope in the future that that is something that we will be able to address. So that's what I have to say. I am so grateful again to all of you and all the work that you're doing. We appreciate it. We are getting our seniors vaccinated. We are saving lives, and I'm happy to do the work. So thank you. And at this time, I'd like to introduce Dr. Hudson from Swedish Hospital. Thank you.
Thank you, Linda. It's a pleasure to be here. I'd like to thank, of course, Mayor Durkan, the City of Seattle, Executive CONSTANTINE, Linda, of course, Linda GREENE, Chief Scoggins, it's good to see you as well. And Swedish is proud to partner with the City of Seattle and be the healthcare partner for this endeavor at Lumen Field. It's been quite a year, and I just go without saying that my heart goes out to those individuals who have dealt with COVID, not only professionally, as we've seen with our frontline caregivers who have done an admirable job taking care of the sick, but also those who have experienced it in their homes with their loved ones and with relatives that they have not been able to see because this pandemic has taken its toll. The vaccine, however, is that ray of hope. And what we've seen the last couple months is that we've developed partnerships as a healthcare organization and with other healthcare organizations to deliver a vaccine as quickly as we can to the population to get them over this hump, make sure that they're healthy, and make sure that they can shake a hand, give a hug, see their loved ones again. And for us, that is a priority. Of course, it started with our strategy of making sure that our caregivers are protected first as people come into our hospitals and take care of the sick. And we were successful in vaccinating the majority of those caregivers promptly. And then we moved into one of the greatest partnerships with Seattle University, doing one of the first community partnerships and vaccination sites to vaccinate thousands of people per clinic in order to vaccinate those Tier 1B over 65 and those 50 and older and multi-generational households. And one of the things I'm most proud of is by March 19th, the 2,600 vaccines delivered to our community association partners out there in the community that are underserved or have trouble accessing care. We're proud to work with them. We're proud to get them protected. We're proud to get them vaccinated. It's what we do. The partnership at Lumen Field is an extension of that. As one of the first large max vaccination sites that we're going to see here in the city, as well as the country, it's time to get over that hump, step up with a safe vaccine. Now that we have Pfizer, Moderna, and now Johnson & Johnson, we're able to vaccinate more people, get them protected, and get them to their families. I want to thank the hundreds and hundreds of volunteers who are not only going to volunteer at Lumen Field, but that volunteered in our clinics, as well as the partners that we've worked with, Denali, T-Mobile, Cellnetics, and of course the University of Washington across all sites, making sure that we diversify and make sure we can get into all those communities to get people safe. Partnerships are key in this, as evident today, and this is what's going to get this turned around and get us to a sense of normalcy, even though we will be dealing with COVID and coronavirus for quite some time. Just because we get vaccinated does not mean we don't wash our hands. So I'm going to say that the most important thing is wash your hands, socially distance, take care of yourselves and your communities, because as we go through this, we will still need to be diligent. I want this message to go out to those who are concerned about the vaccine. The vaccine is safe. It's safe to have that administration. It's safe as we move forward, and it will actually help protect not only you, but your family members and those that you love in your communities. It's very important. So on behalf of Swedish, a special thank you to the city, Executive CONSTANTINE from King County, Linda GREENE, and the wonderful partnerships, and of course, our partners out there serving all, because that's what we do. Our mission is to serve everybody and take care of our community. And on that note, I'd like to turn it over to Chief Scoggins, who will then deliver the next remarks. Sir.
Hello, good morning to everyone out there. You know, today is another exciting day. We're crossing another threshold. It was almost 9 months ago when we opened up our first testing sites here in Seattle, and now we have 4 open, June 5th, 2020. Since then, we've tested over 650,000 people, and that came from an idea of Brian Wallace and Sarah Smith and our entire team. And looking where we are right now, 9 months later, it's absolutely incredible. Since June 14th, our teams, our mobile vaccination teams, have visited over 140 locations. This weekend, we passed over 10,000 doses delivered, and most of those have been out in the field, taking those doses to people. That's really important for us. That's not done without partnerships with the University of Washington, our new partnership with Swedish, our partnership with Seattle King County Public Health, but really working with our city family, with FAS and with the Office of Immigrant and Refugee Affairs, Department of Neighborhoods, and Human Services departments. That really helps us define the locations that we've been going to since June 14th. So it's exciting that we're going to transition 2 of our testing sites into testing/vaccinations. We're really excited about that. The more the vaccinations come, the more days we'll be able to add. Our team has capacity, and just like the doctor said, you know, a part of who we are is here to serve the community. That's what we do. We live our mission each and every day. We find a way to stand in the gap. Thank you to Mayor Durkan for all of her leadership and guidance and trusting in her fire department to believe we can get it done. And I think we have really been getting it done. And with that, I'll turn it back over to our mayor. Thank you.
Thanks, Chief. And the chief mentioned the names, but if I want to say again, Brian Wallace and Sarah Smith, who are both here. Brian, raise your hand. Sarah, raise your hand. They have done phenomenal work spearheading our testing. 1 out of 3 Seattle residents has been tested at our sites, is what our data seems to show. We now do 20% of the tests in the state of Washington. That's how quickly we were able to scale it up, and we hope to do the same on vaccination. So we'll take questions to anyone addressed here. If you could keep it to the vaccinations first. If you have questions on others, hold that to the end. That'd be great.
The city has been asking for 1,000 shots a week. How many are you going to be asking for now, and what the confidence that you'll actually receive those shots?
So I was on a call this morning with a group of mayors discussing what the flow would look like. We're in a supply problem right now. We expect that supply problem to actually shift by midsummer into a marketing problem. But we think that we'll be able to get at least 1,000 vaccinations a week at this site and the West Seattle site. We're hoping to scale that up quickly so that we can do that even in a day.
We're getting 3,500 this week, 2,500 first doses, and 1,000
We're getting 3,500 this week, but it's both first and second doses.
Dr. Hudson? Deal, but I didn't hear much in the way of concrete plans. How is that going to work, and when can people finally show up at the stadium to get their shot?
We'll be opening up later, and as soon as we know what the status of the supply is, we're going to put out information. I think one thing we want to make sure is, I think everybody's frustrated, and the worst thing we could do is to create expectations and not be able to live up to them. So we want the public to know that it's coming. As soon as we have more information, we're going to be telling people how to register and how to get down there. It will come online. It will have significant capacity. And if we're able to get enough vaccines, we think that we can do upwards of 20,000 in a day. But that will take us scaling up both personnel and vaccines.
Weeks away.
That is weeks away.
Mr. Mayor, I have a question for you.
Sure.
I'm a general contractor, and I help here. See my truck. I clean this park. I've been harassed by city police. I keep being ticketed, and I clean this park since day one. I'm an ex-mixed martial art trainer. I train people here, you know, do good, do this, do that. And unfortunately, we don't get no support. People came here, they said we want to help, putting the stuff up. I'm the one give idea to have people that can work out in the community center for free, because some people they cannot afford, and it's been happening. It changed a lot of view here. It changed a lot of people mentality, a lot of different things. It's not about people, it's a good people. You know, even when the police was not here, there was nothing happening. Sometimes it's far the consequences when the police here. I'll be honest with you, I don't hate the police. I support the police, but I'm the one being infected from the police. The second thing to share, I'm a general contractor. When it said help, and they back in the day they used to arrest people selling weed, and that's wrong. When they legalized it, I opened a weed shop for socially. At that time, it's for medical use to help people. Those people, I don't even want nothing from it. And I was washing cars, and over here in Blues Auto Detail is being closed. And I'm going back and forth to Alaska working for minimum wage. I don't want that money. But at the end of the day, 12 GREENE is being shut down and it's given to white people. And we're still struggling in your city. And my shop is 323 North 105th Street. white person came and opened up there. It's not about white and black, but it is. Because it's sad. The people they help, they don't get help. I help everybody, even mattresses. I go to the homelessness, give them mattresses and this and wood. They can have fire. But at the end of the day, we're being ticketed, we're being harassed, and it's sad. Even if stopping a freeway, oh, we want to check your truck. Too many trucks in the freeway. Only that black guy. The one he on 12 Green. 12 Green is the weed shop, and the LCB, they're not fair. They make stuff for them. Unfortunately, I used to go in Aurora, my shop in 323 North 105th Street. I used to buy pizza from a place. It's a Mexican lady. Now it's a weed shop. We get pushed away. The thing is not about weed, but the people they help, they will never get help.
All right. Can I, two things. First, thank you for your work.
Nobody allow
All
me.
right.
I tried to meet the sheriff of the police. Nobody allow me. Your office people, they deny me and they push me away. It's sad.
All right. Well,
It's very sad.
I've got someone here from my office. We'll get your contact
They
information.
will get
First,
that, but at the end of the day, they lead me away.
all right. First,
be
I want to
honest with
thank you for your work.
Well,
And I
the
also
thing is,
want to
I
say,
want fairness. I want you. I'm in your city. We voted for you. I represent Sudanese American and the Somalian community. I'm mixed guy, and mixed with Arab and a little Jewish. It don't make me better than anyone. But I support a lot of community. My community is more than 65,000 people Washingtonian. We have Sudanese American Association. We call it Sudanese American Association. We didn't say Sudanese Association.
all right. Right behind you is
So-
Anthony
so
from my
it was
office.
sad for us,
Okay. And
you
sir,
know,
you've raised
but-
some really good points.
I would trust you, but I would like you, the liquor board, to speak to them. They have a social equity called SB 2870, adding a 34th shop for social equity, but they plan it for themselves.
All right.
It's so sad when they try to talk. They was talking about the funding for those people later, the people with color, so they can have those for Wales. I don't
All right.
want it for Wales.
All right. Let me do this. Let me
I'm
get
not better than
answer
anyone,
some
but
other
at the end of the
questions.
day,
But
this is damaging the community. A lot of people frustrated, and they're not going to vote for you guys anymore.
all right. Let me get you some more information. I want to thank you for your
Well,
questions.
It's a 12 Green. It's in your city. 12 Green.
All right.
You can contact
I'll
the
talk to the
12
governor's
Green
office about
office.
that.
My name is Sami Abdullah Saad.
All right.
The LCV, they call me in my middle name. Mr. Abdullah, you need to withdraw your application.
All right. Thank you,
This
sir.
is sad. This
All
is
right.
my application. I want this to be in the air.
All
The
right.
American people that we know.
Thank you.
Muslim people that we know.
Thank you
No
for raising the
Muslim guy
concerns.
on that field. We don't want the money. We want to help.
All right. Thank you,
I
sir.
help mixed martial art. Ask everybody over here. I'm not the. But sorry to cut you off.
No, it's all right. Thank you very much,
You
sir.
can have it, but I wanted to help you guys.
All right.
Mayor, are you worried to make this announcement today about Lumen Field without having necessarily the allocations there or a date set? Are you getting people's hopes up?
No, I think it's really important that people understand what's coming. I think part of the problem throughout this crisis has been that people don't know what to expect and when to expect it. And so we want to make very clear, we will have a mass vaccination site that will be able to do a large number as soon as we get that, and we will be talking to the public along the way so they know when that's coming online and what to do. We also will continue all of the sites throughout the county, the executives here. We've been very thoughtful to site ours in the city of Seattle in conjunction with the planning the county has done and together with our healthcare providers so that we have a vast network of vaccinations, but we've really focused in the city on making sure that we can connect to those people who are most immune, most susceptible to the disease, most vulnerable, but not connected to the systems.
How important is it to get this framework built now ahead of the next phase? We know essential workers, it'll be large.
It's huge for us to start building the infrastructure now because we know, again, right now we have a shortage of supply, but pretty soon we won't. So we have to get the structures in place. People have to know what's coming and know their turn will arrive because there's so much frustration and uncertainty right now. But we will get enough vaccine, and it will shift, my guess, sometime this summer to trying to convince those last people to get vaccinated rather than dealing with all the people that want to be vaccinated.
Lumen Field, will they extend through the pandemic? I mean, will they stay open?
We will keep them open until we reach the point where we feel that they're no longer needed. One of the questions we've gotten from a number of people is, will they be exclusively for Seattle residents? Our testing sites have served people from other counties, adjoining counties. We obviously want to prioritize Seattle residents, but we know to get to those critical numbers that we will be taking more people at Lumen Field. And also, look, it's just a reality that a lot of people who lived in Seattle can no longer afford to live in Seattle. And we want to make sure that all families are served.
I'm wondering if Dr. Hudson, if you could maybe speak to the vaccine supply a bit, your perspective, and also, what is realistic in terms of when you'd be able to actually ramp up to 20,000 or so a day, and what would it take, staffing-wise and such?
Yeah, so to date, we've administered at Swedish just shy of 87,000 doses of the vaccine. And it has been based on supply efforts. The governor's office has been working diligently and very hard and admirably, actually, to make sure that we can get our populations vaccinated as quickly as possible. So the efforts from the federal government, the state government, the local governments, the mayor's office, Executive Constantine, these partnerships are critical for us to be able to get the supply that we need to vaccinate. So when we first started with the allocations, it was to get the frontline workers, those that are seeing COVID every day, vaccinated. Now that we're tiering and we're opening up to get the population vaccinated, sites like Lumen Field are critical, because when the supply opens up, as the mayor indicated, and our ability to do 20 to 21,000 doses a day, we can really jump on this quickly to get the population vaccinated and safe. Until that time comes, we've done a lot of other efforts with the supply that we're given to make sure we get to the most vulnerable, to make sure that we get in all of our communities, and to make sure that we're able to set up community clinics. And our capacity at Seattle U had a capacity around 3,500, to make sure that we can do those things effectively. The diversification of the offering to get people the vaccines should and will continue, because we need to get people vaccinated in their communities. Some people can't make it to Lumen Field. Some people can't make it to the Seattle U clinic. But the thing is, we can go to them. So University of Washington, it has mobile vaccination clinics. Swedish has mobile vaccination clinics. The healthcare system has come together to make sure that we can do this effectively and safely.
What's realistic then, though, for when you can really ramp up? I mean, are we talking, that 20, 21,000? Are we talking this month, next month, May? Any ideas at all?
As soon as possible. As soon as the supply dictates. And the diligence with elected officials, the governor's office and the federal government, they're working on this every minute of every day to make sure we get the supply we need. Everyone understands the importance of this with care of our communities, because the faster we act, the more lives we save. This is about saving lives. So everyone's working around the clock to make sure we do this right.
Can you lay out some of the basics of who is eligible now and how do they sign up? What's the simplest way to say that?
So we are still in Tier 1B, which are those 65 and older, and those 50 years and older in multi-generational households. And then that'll move into the next tier when the time is right, when we're able to get the majority of that tier completed, and the supply will dictate that we can expand into another tier. The Department of Health has set up the site to log on to the Department of Health website in order, if you meet those criteria, to sign into one of the vaccination sites that's going to be closest to where you live if possible, and convenient to you as possible. But as the sites expand and the offerings expand, the idea is to get care close to home for those that need it and get sites close to people when they need it.
Yep. I want to just add to that real quickly. It's really important for people to understand that the West Seattle site and this site are being done by registration through the community-based organizations. And so we are reaching into communities to try to find people who might not otherwise have access. Chief Scoggins?
Sure. So the question is, there are multiple pathways to get a vaccine. There are pop-up sites, there are mobile sites, and soon there will be Lumen Field as well. How do you, given the limited supply, how will you make decisions about allocating how many shots to these different efforts?
Well, I think we're fortunate that we have some really smart partners who help us with those decisions. We're on the end of that in the distribution point. Like here at this test sites, our firefighters are doing the injects. So the decisions on where they're going and who's coming to us, Seattle, King County, Public Health, all of our community partners, they're really helping with that. So that decision isn't left up to us.
Chief Scoggins, how's that challenge your staffing?
Well, absolutely, it challenges us. We're staffing 33 fire stations every day and all the other work that we do every day. But I'm really proud of our firefighters because we see how important this is. We've been going strong in this, not just in this space, but responding to people who have been sick and have COVID. In the last 9 months, last year, over 300 of our firefighters have been in isolation or quarantine. 30% of our sworn firefighters. We know how important this is. We see the impact up close and personal, whether it's our own firefighters or the community members that we respond to every day. So our firefighters see the value and we're working hard to contribute.
I just want to add to that for our Seattle Fire. The residents and business of Seattle can be really proud. And at the very beginning of this, if we go back a year, we'll recall that our long-term care facilities that we saw just outbreak after outbreak and our senior citizens cut off from their families and more disease spreading. At that time, the CDC said you could only get a test if you had symptoms. But the medical professional said most people are asymptomatic and spreading the virus for a period of time. So we got permission to get the Seattle Fire Department certified to go in and do testing at one Seattle facility and test everybody, every resident and every provider. And what we found is a number of people testing positive who showed no symptoms. The CDC then used that as part of the way to change some of the guidance, and we were able to go in. And they were able to scale up from our senior homes to testing first responders to now the scale that we have throughout the city. And again, we want to do the same thing for vaccinations. And I can't thank our partners enough, our community-based partners. King County has just been invaluable. The healthcare system, Swedish Hospital and other partners, UW has been just the gold standard for us in our lab testing. So we're looking forward to moving this forward. Any other questions on vaccinations? If not, does anyone have other questions they want to address to us?
Dow, you'd mentioned the Auburn and Kent sites. Are those also providing vaccinations? Are there additional county sites that are providing vaccinations? Can you clarify that?
Yeah, those are county sites, and they are mass vaccination sites. They have been available to those 75 and over, as well as the people in Group 1A. But I want to let folks know that as of this week, we are expanding the eligibility to 65 and over for those sites as well. So it'll be the same countywide because we've had some real success in increasing the number of people in that highest risk group, over 75 in the county, being vaccinated. We also opened one, as I mentioned, in Redmond, and that is in conjunction with Microsoft, but is also really focused on reaching out to the most at-risk communities, BIPOC communities, people who've been disconnected from the system or excluded from the system historically. And we are going to continue opening sites. I'm looking into being able, in some weeks when the supply is increased, to opening another East King County site, maybe further east in King County, to try to reach rural residents and people in the smaller cities in the eastern part of the county. It's been a remarkable effort by so many, public, private, for-profit, nonprofit, to try to make sure that we are getting these vaccines out everywhere. And, apropos the question was asked earlier, we really need to have the capacity in place before the vaccine supply increases. We do not want to be in a position of not being able to get the vaccines out immediately. So in Auburn, in Kent, we are building the capacity to be able to distribute thousands per day. And we're going to be doing that in Redmond and at the other site or sites we're able to open in the future. I believe that this community, and particularly between Public Health Seattle and King County and the City of Seattle, we are going to be able to stand up enough capacity to manage the supply as it's coming in and make sure it's not just distributed quickly, but it's distributed to the people who need it most and the people who may have had the hardest time getting access.
Question for Dow.
Yeah.
Last week, Regina Cannon said thanks but no thanks. She doesn't want to be your regional homeless authority director. What's that say that nobody apparently wants the job?
Well, it's not that nobody wants the job. They had, I think, 16 applicants. So the implementation group is going to be meeting, I think, today to discuss that, and I'm sure they will not have any problem coming up with additional folks to negotiate with. I am very anxious for them to have a paid professional in charge to be able to help manage the affairs of the group and set the direction. And I think that it is going to be something that's going to happen pretty quickly. Okay.
Time for 2 more. Unless there's no takers.
I got one more. So I've heard a lot about community outreach being the way that's connecting with people who are eligible for the vaccines. But for proactive seniors who want to get on one of those lists, what do you recommend?
Well, I would start, and you may want to jump in as well.
Yes.
I would start by visiting the Public Health Seattle and King County website to find where vaccines may be available, as well as the State Department of Health. Obviously, this is one of the inequities, right? If you're computer literate, or if you have kids who are computer illiterate, you're in a better position than others to get signed up for the vaccine. My parents had 2 sons who were busily scouring the internet to try to find them appointments, and finally, eventually did. And now my parents, who are 90 and 93, have just received their 2nd vaccine, which is a great relief, I can tell you, to me and our family. But did you want to talk about how seniors could? Yeah.
Thank you. I just want to keep it short and simple, particularly to address your question. For those seniors who are 65 and older, the simplest way is for them to call 206-722-0317. We are manned up, or womaned up, and we have folks available to take the information, and we are getting back to them that same day. So they can call us, and then they will get an appointment for a vaccination the same day. We're fortunate that not only are we partnering with the City of Seattle, but also with Safeway, and we have vaccination appointments available this week. So it can happen, and it will happen. If they call us, we'll make it happen.
Thank you, everybody.